How do infections cause arthritis joint damage? Imagine a tiny invader slipping into your joint and setting off a chain reaction that can cause real harm. That's what happens when infections reach the joint space. Bacteria, viruses, or fungi can enter through the bloodstream, especially if you have an infection somewhere else in your body like your skin, lungs, or urinary tract. Sometimes, injuries, surgeries, or puncture wounds near a joint give these germs a direct path inside. Once inside, these organisms trigger your immune system to respond. White blood cells rush to fight the infection, causing inflammation. This inflammation makes your joint swell, turn red, feel warm, and hurt. While this is your body's way of protecting you, it can also damage the joint itself. The lining of the joint, called the synovium, can become inflamed and thickened. The cartilage that cushions your bones can also suffer. Bacteria are often the main culprits in infection-related arthritis. For example, Staphylococcus aureus bacteria can multiply quickly in the joint and releases toxins that damage tissues further. If not treated fast, this can lead to the destruction of cartilage and even bone, which can cause permanent joint problems. Viruses like parvovirus, hepatitis B and C, Epstein-Barr virus, and alphaviruses can also cause joint inflammation. Usually, the damage from viruses is less severe and often temporary. The immune system's response to these viruses, especially the formation of immune complexes, clumps of virus and antibodies, can cause ongoing inflammation in the joint. Fungal infections are rarer but can cause slow, progressive damage over time. Fun from soil or bird droppings can enter the body and settle in joints, especially in people with weakened immune systems. People with existing joint issues, weakened immune defenses, or those taking immune-suppressing medications are at higher risk. Artificial joints are also more vulnerable because bacteria can stick to the surface of implants. The key to preventing lasting damage is early diagnosis and treatment. Doctors use antibiotics, antivirals, or antifungal medications to clear the infection. Sometimes, draining joint fluid helps remove harmful substances and relieves pressure. In essence, infections cause joint damage by sparking inflammation and directly harming tissues. The immune response, meant to protect you, can sometimes turn against your joints if the infection isn't caught and treated quickly.